So actually, I'm going to talk more around smoking cessation and where nicotine pouches actually fit into our smoking cessation care. First of all, I want to say thank you for making me get up this morning and think I'm still in Newfoundland. It's rainy, it's cold. Thanks for teasing me yesterday with 28 degrees. I had to go to the mall, I had to buy clothes. That's the story for my husband. But I did not bring anything for 28 degrees, and then I get up this morning and it feels like I'm back in St. John's. But I will tell you a little bit about me. I have practiced in Ontario for 15 years. I actually was at the head office at Walmart Inc. in Argentia Road in Mississauga. So I've been a pharmacist for a very, very long time. And the talk this morning really hit home with me. When you look at risk factors for osteoporosis, you think about over 55, all of those things, alcohol. I'm like, oh my God, I need to get tested immediately. But I am still a pharmacist, so I do work with an international company called Omnicom Health. What I do is I develop programming for pharmacists, both in North America, but mostly for pharmacists in other countries. So it's really nice to see pharmacists in other parts of the world getting expanded scope. But I still practice. I still practice in a small town in Newfoundland, and when I say small, I mean small. I'm the only pharmacist, or we're the only pharmacy in town, so we deal with everything. I'm a CDE, so I deal with everything from diabetes to smoking cessation to osteoporosis to everything. We are the go-to, particularly in a community that has no family physician. So the reason I'm here, and I want to also point out, I do not work with BAT, the maker or the distributor of Zonig. I'm a pharmacist, and the reason I'm here is because, like any true Newfoundlander, my family is everything. So for 36 years, my uncle smoked, or as my aunt said, the whole family smoked. And he had tried everything. And he, like a true Newfoundlander, worked in Alberta. And he was a heavy equipment operator on the oil fields. And he called me one day and said, they're no longer going to allow us to smoke in the rigs. That was literally the worst thing that ever could happen to him. He could not smoke while he worked a 12-hour shift. So he said to me, you gotta help me. And I had just been, introduced to Zonig. So I told him, try this. He said, because I've tried everything, and I don't want any of the boys to know that I'm trying to quit smoking. So he started to use it. And until this past August, when he actually passed away from a stroke, 36 years of 25 cigarettes a day takes its toll on the body. But he went 11 months smoke-free. He had never went 11 minutes smoke-free. So I'm here because I think as pharmacists, we need to know what's available. But most importantly, we need to start to think about what is Zonig and what isn't Zonig. Because I have read so much, and when I hear particularly our government talk about nicotine pouches, most of the things they're talking about are not Zonig, not the 4 milligram NRT. They're talking about what a lot of people are buying online, including my own son, and I'll tell you that story afterwards. So I am, as I said, I'm not an employee of Imperial Tobacco or BAT, but I have received an honorarium for the preparation and delivery of this program from my employer. So here are our learning objectives. I'm really going to focus on number 3 and 5 because I'm going to talk to you about, as I said, what Zonig is, what it isn't, but I'm also going to talk about the difference of the pouches, now you got me saying patches, the pouches that are available in Canada, both legally and in pharmacies. So before I get to that, let's talk about why we need to evolve how we approach smoking cessation. So one of the things that I love to do is to mentor pharmacy students. So this past summer, as I said, I typically only work on evenings or weekends, but I had a pharmacy student who always said, can I come in and work with you? Because typically when I worked on Thursdays, I would have some type of clinic. So she came in and I said, today we're not going to do diabetes, we're going to do smoking cessation. She goes, what are you doing that for? No one even smokes anymore, everybody vapes. And then she was tall, skinny, young, so I immediately didn't like her. So I went, just joking, she was lovely. But I said to her, you'd be surprised how many people still smoke. And according to the CTNS, or the Canadian Tobacco and Nicotine Survey of 2022, 3.5 million Canadians still smoke combustible tobacco. So that's 3.5 million Canadians are still smoking. So yeah, there was a need to have a smoking cessation clinic. What we do know as well, in 2022, of those people who smoked, 31.4% of them had tried to make a quit attempt that lasted at least 24 hours. So we know people are trying to quit. What I find as a pharmacist most, I guess, sad, is that only 26.3% of them used NRT. So there is products available to really help people quit smoking, but they're not actually asking for help. Almost 63% of them are trying to do it on their own. They're trying to use nothing. They're trying to use willpower or cold turkey. And I don't know about you, anything called cold turkey, don't fill me with confidence. And we know that people who do try to quit without any help, they're only likely 4 to 7% effective. So we know that people are trying to quit, but the success rate remains very, very low. So in 2022, about 822,000 Canadians above the age of 15 tried to quit and were unsuccessful. And one of the things I also do with my pharmacy students, I'll say, have a guess. How many times does it, on average, can it take a person to quit? How many times, does quit attempts does it take for them to be at least 1 year quit-free? And most of the students will say 3, 5, 10. Dr. Shelby and his group found that it actually takes up to 30 times for someone to try to quit before they're even 1 year smoke-free. If you look at long-term or lifelong abstinence, it can take even more than 30 attempts. So quitting smoking is hard. And if you have I have never smoked, and it's easy for me to say quitting smoking is hard, but I have family members who have tried numerous times, and they said it's probably one of the hardest things they've ever had to do in their life. So we need to change what we're doing, because I can tell you when I graduated, and I graduated probably, by the look of you, I probably graduated before some of you were born. And the way that we were told to look at smoking cessation, how to interact with patients, is much, much different now than it was then. So we need to evolve what we're doing. And how can we do that? And it's easy for me to say, oh, you need to do X, Y, and Z, but my pharmacy may operate differently than your pharmacy. But there are some key things we need to start talking about. And one of those is to start thinking of smoking as a chronic disease. And you've probably heard this on multiple smoking cessation talks, but we really do. As a CDE, I never have to stand up in front of someone and say, consider diabetes a chronic disease. Because we do that by nature. But we don't. If you actually look, and a lot of surveys that came out in 2025 showed that most healthcare professionals still consider smoking as a lifestyle choice. And it isn't. It may be a choice to have the first one, but after that, it is a substance use disorder. And if you look at the DSM-5, it says that anyone who has tobacco use disorder needs 2 of 11. Can this thing work? Oh, no, it doesn't. Okay, no problem. You need to have 2 of 11 different symptoms, and 7 of those are listed here on the slide on to your left. Now, most of my patients, they have all 11. I literally, way back when I was practicing in Newmarket, Ontario, I had a gentleman who came in with his wife, and they literally got in a fight in front of me because he had stopped in the 401 to have a cigarette. He had to have a cigarette. And she said he put his life in danger and put our lives in danger because he had to stop on the side of the road to smoke. So they find it very difficult to quit. They'll put themselves in hazarded places, hazarded use. So thinking of smoking as a chronic disease that needs our help is the first step in how do we change our practice. The other thing we need to do is to start to think about not just how much they smoke, but the level of their dependence. So when I graduated, and you'll see a lot of the tools that were on CAMH, it said the first thing you need to do is ask people how many cigarettes per day they smoke. And then you choose a pharmacotherapy based on that. That's only half the story. The level of dependency is so much more than the number of cigarettes per day. So someone who smokes 15 cigarettes a day can be less dependent on nicotine than someone who smokes 10 cigarettes a day. And the reason is because nicotine dependency is caught up in a multitude of factors. The strength of the nicotine in the cigarette, the number of puffs, the depth of the puff. So if you saw my uncle, like literally, the only thing he didn't suck in was the couch when he was smoking. He wanted to make sure he got enough nicotine out of every cigarette. He said, I paid for them, I'm using them. Someone can be a slow metabolizers. So people of African and Asian descent typically metabolize nicotine much slower. So nicotine stays in the body, which means they may not need 4 milligrams of an NRT, and they may be able to start with 2, or they may not need 4 as long as other people who are rapid metabolizers. So age is another factor. There's gender differences and behavioral differences. So the reason I talk about this is because there's more to assessing what pharmacotherapy people need than just saying how much you smoke. And one of the great ways of doing that is the FTND. Show of hands if you've ever used this 6-question questionnaire in your practice. Yeah, so it's 3 of us on an island. It's such a great tool, and I'm going to be honest with you, I don't use it. My technicians use it. They're great. They know anyone who comes into the pharmacy, and we're a small pharmacy, so the moment someone walks in the door and they've been smoking, we can smell it. We know that they're smoking. And we'll always ask these questions. And particularly if they're waiting for a pickup or it's part of a clinic, we'll ask the 6 questions. But not all of us have that time. So a great tool is to use these 3 questions. Always ask how many cigarettes you smoke. You need to have that baseline. But the other thing to ask is, have you ever considered quitting or reducing smoking? Because if someone has thought about, I would love to get from 20 cigarettes to 10, that's your way in. They've likely tried to quit in the past and were unsuccessful, so they look at reducing as a journey to quitting. And lastly, of all the questions on the FTND, ask the first one. How soon after you wake do you smoke? And if they answer within 5 minutes, they automatically have high nicotine dependency. And you'll notice I don't say the word addiction very much. I actually went to Sweden to an international nicotine forum in August of this past year in Stockholm. And in Sweden, where we had the first country to ever become smoke-free or less than 5% smoking, they don't use the word addiction. Because we don't call people with diabetes sugar addicts. If it's truly a chronic disease, it's not an addiction, and it's a dependency. And the word addiction has so much negative connotation and stigmatization that people don't like it either. I had a 64-year-old patient come in to me once, a lady, and she had just quit. She had quit smoking. She came back in about 6 months later into the consultation room. Small area, I knew right away she had started smoking again. And I said to her, I'm really, really sorry, that you relapsed and, and that you're smoking again. I'd love to help you with your addiction. And she stopped and she looked at me, she went, relapse? Addiction? She said, I'm not taking cocaine, I'm only smoking. And she was so upset that I had called her an addict and I had said she had relapsed. Because we don't typically speak to other patients with chronic disease in the same tones. So it's really important, as I said, to really gauge the level of dependency, not just the amount people smoke, when you decide what NRTs or what smoking cessation aids or pharmacotherapy you're going to use. So that's sort of a preamble to why I'm here today. To talk about Zonic. Who has Zonic in their pharmacy? Just a show of hands. Great. Who, when you first got it in, went, I don't know if I should do this? Yeah, right? And I was the same. But I'm telling you now, I have never once ever thought about, I shouldn't carry opioids, I shouldn't carry benzodiazepines, I'm not going to order them in because I'm afraid how people use them. Am I afraid? Absolutely. Do I do my due diligence to make sure there's no drug diversion? Absolutely. But I want, as a smoking cessation advocate, I want to make sure that every arsenal, every tool that's available is in my pharmacy and is up to me to be the gatekeeper. So what are Zonic nicotine pouches? They are Health Canada authorized as an NRT. And you're probably thinking to yourself, well, but there's so much more out there. Zonic is the first and only one authorized by Health Canada. It has 4 milligrams of nicotine per pouch. Just like the gum, just like the lozenge. The ones that you are hearing about, whether from other colleagues, whether it is our own federal government, anything above 4 milligrams is illegal. And I'm going to talk about that a little in more detail at the end. So Zonic is 4 milligrams. It is licensed. It was studied as an NRT. It is a natural health product like other NRTs. It does have an NPN number. And it's available in 3 flavors, mint, mint, and mint. You know, right? So it's regular classic mint, spearmint, and peppermint, in case you're wondering. And as you know, with the ministry, the ministry order of August 2024, there were other flavors, but all pouches now, all NRT going forward, must be some form of mint flavor. So any of the other flavors are no longer on the market unless you're a legacy product. So what's in it? As I said, medicinally, 4 milligrams of nicotine. Non-medicinally, it doesn't actually have a lot. So it is a plant-based fiber. If you've never seen, I'm sorry, I'm so used to walking around the stage. If you've never seen it before, it's literally just a little white pouch. It's this big. And it's plant-based. The pouch, or the fleece they call it, is actually methylcellulose, so it's plant-based. Inside is water because you need it to be moist if it's going to be placed under the upper lip. And then it's flavored with xylitol and sucralose. And it's a CDE that's really important for me. Because if I have people with diabetes and if this was flavored with sucrose, they would have the carbohydrate count. So the fact that it's a non-nutritive sweeteners is a really good thing. And then it has the flavor. So that's basically everything that's in it. In terms of how to use it, I don't have to tell you, most of you are practicing pharmacists, be very, very specific in how you want people to use the pouch or how it's supposed to be used. And the reason is because if you don't, they will do multiple things. So make sure you say 1 pouch at a time. It is not 4 milligrams is good, so 8 milligrams must be wonderful. No, 1 pouch at a time under the upper lip. So the way I think about it is place it, leave it, discard, and then repeat the dose if needed. So it goes under the upper lip, not the lower lip. And the reason is anything that we put under the lower lip is going to increase production of saliva. So there's going to be more saliva. And the reason we don't want that is more saliva means more nicotine will be swallowed. Anybody know what the major side effect of swallowing nicotine? Pardon? Hiccups. Anyone comes into you, unless they're having an issue with their diaphragm, but if they are a smoker or a user of NRT and they tell you they can't get rid of the hiccups, it means they're swallowing too much nicotine. There will be also some stomach upset as well, but it's a good thing to look out for. So they place it under the upper lip. My uncle used to call it the sweet spot. Right sort of here in this area here towards the nostril. They can wear it there. Nobody knows it's there. They can wear it up to 60 minutes. Now, he said he never wore it a lot more than 35, 40 minutes because his craving was gone, but it's a maximum of 60 minutes. That's how the PK study, how it was studied for up to 60 minutes. And then they take it out. Now, every patient in the world will say to you, well, okay, if I only wear it for 30 minutes, can I reuse it? Because this stuff's expensive. It's much cheaper than other NRT, but people, they're thinking about their wallets. And the reason, and I'll always say to them, no, do not reuse pouches for 2 reasons. One, that's gross. Taking it out, laying it down, putting it back into your mouth, not very hygienic. And the other thing is, we know, and you'll see a little later, that after about definitely up to 60 minutes, there's less than 1.2 milligrams left in the pouch. So if they then later in a couple hours have a craving and there's only about 1 milligram left in the pouch, is likely not going to curb their craving. So no, do not reuse the pouches. Now, typically you would tell patients to make sure 1 hour and then take it out. I had a patient who really struggled with cravings overnight. She was getting up throughout the night to smoke. So she called me the next morning. She said, you lied to me about these pouches. And I went, did I? I said, why? And she said, well, I put it in, I went to bed, and I got up the next morning, it was still there. So I did my mother thing. You know, you look at your kids and you go, really, did you just say that? But I looked at her and said, I don't understand. And she said, well, I thought it was going to dissolve. I didn't, she had been using lozenge. She thought it was going to dissolve in her mouth. So I hadn't told her that. My fault. The other thing I hadn't told her is that when it comes out, it looks the same, but it's very flat because the nicotine dissolves. So that was very disturbing to her as well. And even though I had said, please take it out at 60 minutes, I'd never said you can't wear it to bed. Again, my fault. So we need to make sure we're very deliberate with our patients. And we tell them to avoid any type of citric or acidic beverages. Now, my uncle said he popped it in, had his cup of coffee, went about his day, nothing happened, but typically it's just water. They can drink water with it. Obviously, there's already water in the pouch, so it's not a problem, but try to stay away from coffees and citric drinks. And there is a sort of a quick guide. There isn't a 2 milligram yet. To be honest, if you actually look in a lot of the EU countries, they don't make a 2 milligram product because they say 4 milligrams is more equivalent to the typical amount that people absorb from a cigarette. But if you do want to help patients reduce from nicotine, and you don't have to write anything down, you're more than welcome to have the presentation, everyone. But it's month 1 is 1 to every 2 hours, maximum of 15 pouches a day. Think about it. If they can wear it for 60 minutes, and 15 a day, that typically covers all of their waking hours. And then in month 2 is 1 every 2 to 4 hours. Month 3 is every 4 to 8. And then obviously 1 up to 6 months, it's as needed. Now, the label will say after 6 months, you should speak to your healthcare professional, but I don't know anyone that I have ever worked with that actually could quit long-term in 6 months. The reason we ask people to quit in 8 to 12 weeks, because that's what the insurance companies cover. If you look at the average time it takes a person to become long-term abstinence for smoking, it's closer to 5 years. So just keep that in mind, but I always have a discussion about becoming tobacco-free, and then the discussion about being nicotine-free comes afterwards, but I always have that discussion. And this thing hates me, it keeps hitting me. Okay, so what are the side effects? The side effects are very similar to all NRTs, whereas basically side effects come from improper use or overuse. So headaches, nausea, as I said, hiccups is because we're swallowing it. So very, very similar to all NRTs. In terms of suitability, you'll see this is listed in the product license, but I'll be honest with you, if I have someone with high blood pressure, diabetes, stomach issues, and they're smoking, I'm gonna use an NRT. I'm gonna use a prescription medication. So it's one of those lesser of two evils. So we do have to be careful, obviously in people who are pregnant, nursing, taking insulin and medications, but when I think about someone smoking combustible tobacco versus using Zonic or another NRT, I'll always pick the NRT. It is approved for reimbursement for private insurance. I put this in here because I think as pharmacists, we all need to know, is it covered? In terms of public, it's close, but not there yet. In my province, particularly in Labrador, we really need NIHB. I'll tell you a quick story. I went to see a friend of mine who we graduated together, and we tend to get together every 3 or 4 years. We always say we're going to keep meeting as long as we're alive. She now works in Newfoundland we call the Big Land, which is Labrador. And she works very close to an Indigenous community. And the regulations on nicotine and tobacco are very much different than what we would see on the island of Newfoundland or in Ontario. So when I walked into the pharmacy, on the back wall was every type of nicotine pouch that had ever been made. Like, it was everything. No Zonic, no Health Canada approved product, everything from about 8 milligrams to 50 milligrams per pouch. And the reason, she said, I don't want them to be smoking, but this is cheap, and NIHB does not cover Zonic, and it has a very limited window in how much any type of NRT is covered. So we need, for all NRTs, we need public coverage, and we need it to be longer than 12 weeks. But these are some of the private insurers that do cover. Now, with the caveat, as you know as pharmacists, it's covered if their plan covers NRT. So in Newfoundland, a lot of the non-government workers, sort of not working in the actual building, they have Sun Life, and their plan covers NRT. So I write a lot of nicotine for them. But if you work in the building, actually as a true civil servant, their Sun Life does not cover NRT. So you just need to make sure, and you can scan the QR code at any time to see what's covered. In terms of the science of Zonic, its bioavailability is very similar to lozenge, but much better than the gum. Now you may say, well, when you study, and this is from the PK study that had to be done for Health Canada approval, you may say, well, it's because most people don't use the gum appropriately. Most people treat it like juicy fruit, or Excel, and they keep chewing it. Very rarely do you see people go chew park. But in this study, because it was a randomized control trial, people were actually monitored. So they did chew park, and everyone used all 3 products for the 60 minutes. So you'll see when you look at the curve, in terms of, and the spike is the blood nicotine concentration, you'll see that the gum, the pouch, and the lozenge are very similar, but the gum is much lower even when used appropriately. What you'll see is this area under the curve, the actual Cmax and Tmax values are very similar for the lozenge and the gum to cigarettes in terms of how quickly it gets into the system and how quickly it's metabolized. The difference is the area under the curve compared to cigarettes is much lower. It's about half. So I always hear, well, can't use Zonic, it's just like cigarettes. It's just, how quickly it gets in the system. It does cross the buccal membrane very quickly, but the actual plasma levels are only half of that of cigarettes. So no, it is not the same. The other thing you'll see is that people like to use it compared to the gum or lozenge. Part of being Health Canada approval as well is you must do a satisfaction study. So basically it's 0 to 100. Anything above 55 means you like the product or you like using the product. The pouch had 54.5% of people who were above 55. The gum was only 9.4, and the lozenge was 10.88. And that makes that's a very important point because as practicing pharmacists, if people don't believe in the product or they don't like using the product, then it impacts adherence. So if someone doesn't mind, because I don't say they like to use any NRT, but if they're comfortable with it, they're more likely to continue with it. Again, side effects were very, very similar. Lozenge was only higher, all minor side effects, but it was only higher because of the rate of stomach upset and hiccups. This is an important one for us as pharmacists because this is actually how much nicotine actually leaves the pouch or the gum. So if you look at the numbers on the bottom, it says pouch 1.26, gum 2.46. You might think, oh, that's good, gum is higher. That's actually bad. What it means, after 60 minutes, of that 4 milligrams, when they take it out, how much nicotine is left in the product. So out of 4 milligrams, the study participants got about 3 of the 4 milligrams for the pouch. For the gum, they only got half of what was needed. So that's an important thing when you see that the pouches actually nearly double the bioavailability or the amount that's available to be absorbed. And in the gum, there's double left in it, so people are may not be getting enough to curb their cravings. So I always say, take away the first 2 lines. If I said to you, product X has better nicotine release, so more nicotine available for buccal absorption and fewer side effects of other NRTs, you say, order it for me. But the moment I put in Zonic pouches distributed by Imperial, people go, oh, no, I can't use that. And I'll be frank with you, because I'm a newfie and that's what we do. I don't care who makes it. I don't care who distributes it. I only care about my patients. I only care that they are not smoking. And I also know that, like every product, not every product, but a lot of products in my pharmacy, not everyone uses them appropriately. And I always hear people come to me and say, well, what about that 25-year-old gentleman that walked in and asked for Zonic? I know he's not a smoker. And you're right. Some people are using it recreationally. But don't assume. Again, I'm assuming he's about 28, 29, came into the pharmacy Sunday afternoon, right? I always work Fridays and Sundays. Friday nights is oral contraceptive nights, and I call Sundays our OTC days. And so a gentleman walked in, he said, can I have 2 packs of Zonic? Now I knew his mom, and he knew I knew his mom. So as soon as he saw me, he turned bright red, but he still wanted his Zonic. He said, "Can I?" And I said his name. I said, "I don't think you smoke, do you?" And he goes, "No, I've never smoked." I said, "Well, do you mind? If you don't want to tell me, it's okay, but do you mind me asking why are you using Zonic?" And he said, "Because if I don't, I will vape. I play hockey with the boys every weekend. Every one of my teammates vapes, and I don't want to vape. So my mom told me about this product." And I have my own son who was a vapor, and he lives now in Barrie, Ontario. I don't have to tell you where Barrie is, but usually when I present, I have to say Barrie, Ontario. I'm sorry. He lives in Barrie, and he was a vapor, and I got him to start using Zonic. Remember that, because I'm going to finish that story in just a minute. So if you remember nothing else, except I got a funny accent, what else I really want you to remember about this presentation is not all nicotine pouches, are the same. And unfortunately, in August 2024, I think our federal health minister took all pouches and he put them into one pot and said they're all the same, but they're not. So if you look at Zonic and compare to what, including my son, bought online, they're very, very different. So when I'm talking to you today, I'm talking to you about Zonic. I'm not talking to you about pouches that our youth and a lot of our adults are buying online. What's available in your pharmacies has been approved and authorized for sale by Health Canada. It only has pharmaceutical grade nicotine. It's only available in pharmacies, only 4 milligrams, only available in mint flavor. And it is only an NRT that is to be used to help people on their quit smoking journey. What people are buying online, and when I hear pouches, they're different. They're illegal. I said here, I changed this a while ago, I said up to 30 milligrams, but as I said, on my trip to Labrador and some of my younger patients, they're buying things like Siberia, from Romania, with up to 50 milligrams per pouch. So I also hear a lot, I went to the Ottawa Model of Smoking Cessation Conference in January in Ottawa, funny, and I heard a physician talk about mouth ulcers. So I went up to her afterwards and I said, "Can you help me understand?" Because I have a lot of patients using Zonic and I've never, ever had anyone talk about mouth ulcers. And Zonic's been available in other countries, a form of Zonic for many, many years. No oral cancer, no mouth ulcers. And she stopped and she said, "Well, it's pouches." I said, "Okay, but what pouches? What strength?" And she said, "Well, most of my patients are using 30 or above." And but that's not Zonic. In your presentation, you kept saying Zonic. Zonic's 4 milligrams. And to say I got the death stare is an understatement. But anyway, I made my point and I walked away because I thought I was going to get physically hurt. But we need to be sure when you're talking to your patients about nicotine pouches that you know what they're talking about, and they need to understand what you're talking about. So very, very important that what's out there is not all Zonic, and it's very, very dangerous. In fact, you'll see in the 2025 CAMH lower risk nicotine use guidelines, they added a section on e-cigarettes and on nicotine pouches for this very point about not all pouches are made the same. So they talk about nicotine pouches being a lower risk product. Absolutely, we know that all of the ones listed here in the nicotine risk continuum are lower risk than combustible or commercial cigarettes. But what we also need to remember is that the lower risk guidelines talk about using 4 milligrams and below of pouches. Well, there is only 4 milligrams, but the one that is approved by Health Canada. Anything above that, you'll see in the second bullet, they talk about it being, it should be avoided, potential of unknown chemicals, ingredients, and dosing. They're being purchased online illegally. Health Canada has no idea what's in some of these pouches. So it's important for us to not assume that people are using Zonic, everyone's using it recreationally, because that is certainly not my experience. They may not be using it for smoking cessation. It is not approved for vaping cessation, but I will tell you, I will recommend anything that gets people to stop smoking or vaping or anything that they consider damaging to their health. The other thing I want to point out to you, finally, is that we need to stop being nicotine adverse. Nicotine is listed by World Health Organization as an essential medicine. It helps people quit smoking. And let's be honest, everyone. We live in a country that just legalized cannabis. But we're all up in arms about nicotine. Do we want people to be using nicotine for the rest of their lives? Probably not. But I also don't force them to say to them, you must quit smoking or you must stop nicotine in 12 to 16 weeks, because it's not their reality. So nicotine does not cause cancer. It does not cause respiratory disease, COPD, does not cause cardiovascular disease. That is smoke. That is combustible tobacco. So very important that we make the connection or disconnection, because a lot of my patients have coupled pouches or NRT with smoking, and they think all nicotine is bad for you. So in summary, for me, I mean, there's a list of everything I talked about. The thing for me is make sure you are well-versed on Zonic pouches, because your patients aren't. They think, and this is my story. So my son, as I said, was a vapor, and maximum 20 milligrams per cartilage. He was vaping. He had went through before, the products were changed. So he did suffer from popcorn lung. He went through the whole gamut. So finally, I got him to start using nicotine pouches. And like any good 28-year-old, he was too lazy to go to the pharmacy to pick them up. So he called me and he said, Mom, I'm in Newfoundland. Because you don't get any 20-something-year-olds to move to Newfoundland. That wasn't happening. So myself and his father, we moved to Newfoundland. They're older, my daughter and son. They stayed in Ontario. He called and he said, Mom, something's wrong. And you do that mom thing where you go, what the heck has he done now? But he said, something's wrong with me physically. And I said, okay, tell me, what's wrong? He said, I can't sleep. I feel like I'm having a heart attack. I don't feel like I can drive my truck. And I said, what's changed? He said, nothing, except I bought Zonic online. In my head, I'm like, you aged. So I said, okay, FaceTime me. Show me what you bought. And he said, it's Zonic. I said, no, show me what you bought, because you can't buy Zonic on this site that you quoted. So he showed it to me, and it was called White Fox. And on the back, made in Romania. So he had went from, he said, 10 to 12 4-milligram pouches a day to 10 to 12 pouches with 32 milligrams per day. So he was having nicotine, he was having a reaction to nicotine. So he was having tachycardia, he couldn't drive his truck, he owns a landscaping business, he couldn't sleep, because he was getting so much nicotine. And the funny thing is when he bought it online, he went and said, Zonic pouches. It came up, he clicked on it, he said it was a picture of Zonic, he clicked on it, then it said, oh, we're out of stock, would you like to order something else? And that's what he did. Thinking he was getting 4 milligrams, he was getting 32 milligrams per pouch. So make sure that you're aware what's available out there, and use any method possible to get people to quit smoking. I know we've all sort of being pulled from pillar to post in different directions, but smoking is still prevalent. It's still there. Let's talk about it as much as possible, and let's use whatever means necessary to help people become smoke-free. Thank you.